Hello everyone, I am Dr. Jennifer Berman, and today my topic is erectile dysfunction, our fertility issue is. This is a subject that many people hesitate to talk about openly, yet is one that affects millions of men around the world and in turn impacts relationships, emotional health, and family planning. The truth is, when it comes to sexual health, silence often creates shame, and shame prevents solutions. That is why I believe that honest, compassionate, and science-based conversations are essential. Erectile dysfunction, often called ED, is not just about the inability to get or maintain an erection. It is much more than a physical condition. It is deeply connected to a man's self-confidence, his relationship with his partner, his overall sense of masculinity. Many men who experience ED feel embarrassed, isolated, or even broken. But what they don't realize is that erectile dysfunction is one of the most common sexual health issues in men, and it is highly treatable. Studies show that millions of men experience it at some point in their lives, and yet so many of them never seek help because of stigma. Now let us understand what erectile dysfunction really is. Physically, is the difficulty in achieving or sustaining an erection firm enough for sexual intercourse. But behind that simple definition, there can be multiple causes. For some men, it is linked to blood flow issues, when the arteries that supply blood to the penis are narrowed or blocked due to conditions like high blood pressure, diabetes, or high cholesterol. For others, it may be connected to hormonal imbalances, such as low testosterone. In some cases, the problem is neurological, meaning the nerves that signal arousal and erection are not functioning properly. And very often, erectile dysfunction has a psychological side. Stress, anxiety, depression, relationship problems can all play a huge role. When men ignore these issues, the problem does not just remain in the bedroom. It spills over into every aspect of life. A man who struggles with ED may lose confidence in his body, draw emotionally from his partner, or even avoid intimacy altogether. This can create frustration, distance, and misunderstandings in a relationship. The partner may begin to feel unwanted, unloved, or even blame themselves. So you see, ED is never just about one person, it is about two people and often about the dream of building a family together. This brings me to the other half of today's topic, fertility issues. Fertility and erectile function are closely linked. They are not the same thing. A man can have erectile dysfunction but still produce healthy sperm, and he can also have normal erections but face fertility challenges due to sperm count, motility, or quality. Fertility is a delicate subject, especially in societies where starting a family is seen as an essential part of life. For couples who struggle to conceive, the emotional toll can be enormous. Many men are not aware that nearly 40% of infertility cases involve male factors, either alone or in combination with female factors. This means that male sexual health is just as important as female reproductive health, and both need to be addressed openly. Now, how exactly does erectile dysfunction affect fertility? The answer is simple yet complex. If a man cannot maintain an erection, it naturally becomes difficult to have intercourse regularly and at the right time during a woman's ovulation cycle. This reduces the chances of conception. But beyond that, many of the medical conditions that cause ED, such as diabetes, obesity, and hormonal imbalances, also affect sperm production and quality. Similarly, lifestyle factors like smoking, excessive alcohol, lack of sleep, high stress not only contribute to erectile dysfunction, but also damage fertility. So when we talk about ED and fertility, we are really talking about an interconnected system. The body and the relationship all working together. Another important point to remember is that erectile dysfunction is not just a problem of older men. Yes, it is more common with age, especially after 40 or 50, but younger men in their 20s and 30s are also experiencing it in rising numbers. Much of this increase is linked to stress, sedentary lifestyles, poor diet, and even the impact of digital life. Constant screen exposure, pornography addiction, and lack of real human intimacy. For younger couples trying to conceive, this can be especially devastating because they expect fertility to be easy at their age, and when it doesn't happen, the blame and frustration often intensify. So what can be done? Good news is that erectile dysfunction and fertility issues are not permanent sentences. They are challenges that can be managed and often completely resolved with the right approach. First, medical evaluation is key. Men need to understand that visiting a doctor for ED is not a sign of weakness, but a sign of strength and responsibility. Through blood tests, hormonal evaluations, and physical examinations, doctors can identify the root cause. whether it is vascular, hormonal, neurological, or psychological. Treatments may include lifestyle changes, medications that improve blood flow, hormone therapy, counseling, or advanced medical procedures. Lifestyle modifications are often the most powerful first step. Regular exercise improves circulation, boosts testosterone, and reduces stress. A healthy diet rich in fruits, vegetables, lean protein, and whole grain supports both erectile function and sperm health. Quitting smoking and reducing alcohol can make a dramatic difference. Stress management through meditation, therapy, or simply building better sleep habits also plays a huge role. Many men are surprised to learn that such basic changes can bring back vitality not only to their sexual life, but to their overall well-being. On the fertility side, treatments depend on the specific problem. For low sperm count or motility, doctors may suggest medical therapies, supplements, or assisted reproductive techniques like intrauterine inseminations, IUI, or in vitro fertilization, IVF. In cases where erectile dysfunction prevents intercourse, there are also methods like sperm retrieval and assisted conception that allow couples to achieve pregnancy even without traditional intercourse. The important message here is that solutions exist and couples do not need to suffer in silence. Equally important is communication. Too often, men hide their struggles out of fear of judgment, and women silently carry the pain of not conceiving. This silence creates a cycle of blame and misunderstanding. A podcast, a video, even a private conversation with a partner can break that cycle. Talking about ED and fertility openly not only reduces shame, but also creates the foundation for healing. When partners support each other instead of blaming each other, the journey becomes easier. Intimacy is not only about sex, it is about trust, openness, and emotional connection. As we reflect on this topic, I want every listener, every viewer, every couple to know that erectile dysfunction and fertility issues are challenges, not failures. They do not define your worth as a man, as a partner, or as a couple. They are medical conditions just like diabetes or hypertension, and they deserve the same compassion, attention, and treatment. The more we normalize these conversations, more men will seek help and the more couples will find hope. In the end, sexual health is not just about reproduction. It is about quality of life, emotional well-being, and the joy of human connection. Every man deserves to feel confident in his body. Every woman deserves to feel desired and supported, and every couple deserves the chance to build the family they dream of. By breaking the silence around erectile dysfunction and fertility, we are not just solving a medical issue, we are healing relationships, building families, and restoring hope. So to every man listening who has struggled in silence, I say this, you are not alone. To every woman who has wondered if it is her fault, I say this, it is not your fault. And to every couple longing for answer, I say this, there is help, there are solutions, and there is hope. Erectile dysfunction and fertility issues are real, but they are not the end of your story. They can be the beginning of a new chapter. One filled with openness, strength, healing, and love. That is why today's conversation matters. Because when we talk openly, we empower ourselves. When we share knowledge, we create solutions. And when we replace shame with understanding, we give people the courage to take the first step toward healing. Thank you for being here with me today. Remember, your health, your intimacy, and your dreams matter. Do not let silence hold you back. Seek help, support each other, and keep believing that your journey has endless possibilities. Erectile dysfunction and fertility issues, we explored what these conditions really mean, how they affect men and couples, and why it is so important to talk about them openly. Today, in Chapter 2, we go one step further. We are going to dive into treatment options, break down some common myths, and talk about how couples can heal together, both emotionally and physically, when faced with these challenges. Let us start with treatments. One of the most important things to understand is that erectile dysfunction is not a single disease with a single cure. It is a condition that has many possible causes and therefore many possible solutions. The first step in treatment is always to identify the root cause. If the problem is physical, like poor blood circulation, then improving vascular health becomes the priority. If the problem is hormonal, such as low testosterone, then balancing hormones may be the key. If the issue is psychological, such as stress or anxiety, therapy and counseling become essential. And often, it is not just one cause, but a combination of several. That is why a complete medical evaluation is so important. For many men, lifestyle changes are the most effective and the least invasive treatments. Simple steps like exercising regularly, eating a balanced diet, and quitting smoking can dramatically improve both erectile function and fertility. Exercise, especially cardiovascular activity, increases blood flow and boosts energy levels. A healthy diet that includes fruits, vegetables, nuts, and whole grains supports vascular health and hormone balance. Quitting smoking is essential because tobacco damages blood vessels, making it harder to achieve erections, and also lowers sperm quality. Reducing alcohol intake and getting proper sleep are equally critical. These may sound like small steps. They often create big changes. Then we have medications. The most well-known treatments for erectile dysfunction are PDE5 inhibitors, such as sildenafil or tadalafil. These medications work by improving blood flow to the penis, making it easier to achieve and maintain an erection. They are safe for most men and highly effective, but they are not suitable for everyone, especially those with certain heart conditions or who are taking specific medications. That is why medical guidance is necessary. For men with hormonal imbalances, testosterone replacement therapy may be recommended. But again, it must be done under strict medical supervision because misuse of hormones can cause more harm than good. Fertility issues, treatments depend on the exact problem. If sperm count is low, doctors may suggest medications, supplements, or procedures that improve sperm production. If sperm motility is poor, assisted reproductive techniques like intrauterine inseminations, IUI, or in vitro fertilizations, IVF may be recommended. In cases where erectile dysfunction prevents intercourse, techniques such as sperm retrieval can be used, allowing couples to still achieve pregnancy with the help of assisted reproductive technologies. These options have given hope to countless couples who once believed they could never have children. But let us also talk about newer and advanced treatments. Some men with severe ED, penile injections, or vacuum erection devices may be prescribed. These sound intimidating, but they are effective tools for men who do not respond to oral medications. In rare cases, surgical implants can provide a permanent solution. On the fertility side, advancements in reproductive medicine mean that even men with very low sperm counts can still father biological children. This is an area of science that is evolving quickly, and the message is clear. There is always hope. There are always options. Now let us address the myths. One of the most damaging myths is that erectile dysfunction is simply a part of aging and that nothing can be done about it. This is not true. While age increases the risk, ED is not inevitable. Men can maintain healthy sexual function well into later life with proper care and treatment. Another myth is that only men with serious health problems experience ED. In reality, stress, fatigue, anxiety, even pornography addiction can cause erectile issues in otherwise healthy men. A third myth is that infertility is always the woman's issue. This belief has caused enormous pain for many women who are blamed unfairly when a couple cannot conceive. As I mentioned in Chapter 1, male factors contribute to about 40% of infertility cases. Fertility is not just a woman's responsibility, it is a shared responsibility. Another myth is that if a man has strong erections, his fertility must be fine. This is also false. Erectile strength and sperm quality are related but not the same. A man can have normal erections but still have low sperm count or poor sperm motility. That is why fertility testing is so important when a couple is struggling to conceive. Now let us talk about relationships. Erectile dysfunction and fertility issues do not only challenge the body, they challenge the heart and the bond between partners. Too often, silence becomes the biggest enemy. Men feel embarrassed and avoid intimacy. Women feel rejected and begin to question themselves. Over time, this can create distance, resentment, and even the breakdown of a relationship. But it does not have to be this way. The key is communication. When a man opens up and says, "This is what I'm going through and I need your support," he is not showing weakness, he is showing courage. When a woman responds with empathy instead of blame, she creates a safe space for healing. Couples who face these issues together hand in hand often come out stronger than before. They learn that intimacy is not just about intercourse, it is about trust, affection, and emotional closeness. Sometimes couples counseling or sex therapy can help guide these conversations and provide strategies for rebuilding intimacy. It is also important for men to understand that their partners often value emotional connection even more than physical performance. Yes, physical intimacy matters, but so does the feeling of being loved, desired, and supported. When men carry the burden of ED alone, they deprive their partners of the chance to share that burden and walk the journey together. Healing begins the moment the silence is broken. Another aspect we must highlight is mental health. Erectile dysfunction can lead to anxiety, and anxiety can worsen ED. It becomes a vicious cycle. Fertility struggles can cause depression, self-blame, even strain mental health severely. This is why counseling and therapy should never be seen as optional. Just as we treat the body, we must treat the mind. A holistic approach that combines medical treatment, lifestyle changes, emotional support offers the best chance of success. As we close this chapter, I want to remind you that erectile dysfunction and fertility issues are not the end of intimacy, love, or hope. They are challenges, yes, but challenges that can be met with courage, knowledge, and support. Science has given us countless tools. Medicine has advanced to offer treatments that were unimaginable a generation ago. But above all, what truly heals is connection. The connection between a man and his partner, between patients and their doctors, and between individuals who choose to speak openly rather than suffer in silence. So if you are listening today and you or someone you love is struggling with these issues, I want you to take away 3 simple truths. First, you're not alone. Millions of men and couples face the same challenges. Second, there are solutions, from lifestyle changes to advanced medical treatments. There is always a path forward. And third, love and communication are more powerful than any obstacle. When partners face this journey together, they not only overcome the problem, but often discover a deeper bond than they ever imagined.